Marissa, if we can start recording and move to the first slide. So welcome everybody. My name is Lisa Parker. I am the Director of Health IT Policy for the Oregon Health Authority, and I'm grateful to have the opportunity to share with you about Community Information Exchange, also known as CIE. There are some efforts going on around the state to help with social service referrals. Some of you may have heard of them by name: Connect Oregon, Unitas, Thrive Local, and Aunt Bertha. This webinar has been a collaborative effort among OHA, 2 Medicaid coordinated care organizations, a community-based organization, and a medical clinic. We're here today because OHA is trying to heighten awareness around these efforts and highlight that joining a CIE is free for interested community-based organizations, tribes, and local public health authorities. We're also trying to make sure there's information available to those of you who have interest in CIE or those who just want to learn more, and also to find where you can contact people for more information. The Oregon Health Authority views CIE as part of a broader strategy to address social determinants of health, and will be included in our future health IT strategic planning work. Next slide. For some logistics, this meeting is being recorded and we will be posting it on our website. The link is at the bottom of this page where you can find it. I'll also be posting it in the chat later. Please mute yourself when you're not speaking, and there will be opportunities for questions throughout the webinar. You can use the chat feature to ask questions or give comments. If we're not able to answer all the questions today, we do plan to address them in an FAQ and post it on our website. So who's talking today? There's going to be several people from different organizations, and we just wanted to make sure we call those out. We have several from the Oregon Health Authority, one person from the Oregon Department of Human Services, 211 Info, All Care Health, Project Access Now, Cascade Health Alliance, and Sky Lakes Medical Center. Our agenda today will be, first we start with an overview of what is CIE, then we'll have the Connect Oregon Unitas users present, then the Aunt Bertha users. We'll have a period where 211 Info can answer some questions, and then we're going to have general Q&A, but there will be questions after each presentation. Our goals today for the webinar is that you leave here understanding what CIE is, understand what possible uses there are and the potential value, know how to get involved or join if you're interested, and have the chance to ask questions and share your initial thoughts. But before we dive in, we're going to do a poll just to see who is in the audience and your understanding or familiarity with CIE. So Marissa, if you could launch the poll. We'll just give that a second. Looks like we have a mix. A lot that are very familiar. Great. But we have some that have never heard of it. So we are going to try to go over some basic foundational pieces so that we bring everyone up to speed. All right. So with that, I am going to hand it over to Hope.
Thank you. I'm Hope Heskin-Shepherd. I'm a policy analyst with the Office of Health with OHA. And so we've said Community Information Exchange, or CIE, a couple of times already, and now we're going to dive into what this is. So CIE is a network of healthcare and human or social service partners using a shared technology platform to connect people electronically to social services, resources, and supports. There are several main functions that make up a CIE. Individuals being served consent to having their information in a CIE. This can be done in multiple ways and languages. CIEs offer some common social needs screening tools, such as the Prepare tool, and also offer customizable social needs screenings or assessments. An important part of CIE is the shared resource directory. This means that users can search by language, zip code, needs, and more in a directory shared across the whole network. One of the core features of CIE are the closed loop referrals. This means the person referring an individual can see the status of a referral and whether an individual's need was met or not. CIEs also have data analysis and reports. For example, a staff member could view a report of the status of referrals or the types of services requested. Specific data could also be used for grant reporting. And lastly, CIEs have different levels of viewing permissions to protect individuals' privacy, send information through digitally protected networks, and can be integrated with other technology systems, such as electronic health records. And now I'm going to turn it over to our Medicaid Medical Director, Don Mottner.
Don might have had to step out, so I'll just take over.
I'm here.
Oh, you are? Okay, great.
Sorry, somebody just let me unmute. Thank you, Lisa. Good afternoon. As you have heard, my name is Dawn Mautner, and I serve as Medicaid Medical Director as well as Senior Health Advisor for OHA, and I'm delighted to be able to participate today because community information exchange is a critical tool as we step back and look at our fragmented system, all the different organizations that are doing the good work to support communities who are most highly impacted, especially during COVID, also by systemic racism, structural disparities. When we look at that fragmentation, connecting all the different parts, different organizations, is a critical tool to be able to reach those individuals and support the task of getting their needs met. We have been excited about the progress that communities are making across the state, across the nation, using these tools to connect, especially not to duplicate or work at cross purposes with partners. We understand that the social determinants and drivers of health, including racism, are primary to the disparities and inequities that we see. And as we consider health system transformation, connecting and communicating across different platforms becomes a big barrier to achieving those alleviations of health inequities that we wish to prioritize. Next slide, please. The meeting social people's needs helps improve health outcomes, which contributes to health equity. Then the information in the CIE can be used to make funding and policy decisions at a community and state level. It connects people with the services and resources they need, which supports certainly the specific needs that have emerged during the pandemic, but we know that those needs reflect deeper and broader needs for communities that have been at risk and that have suffered inequities for a long time, looking at the opportunity to build back better after and in the wake of COVID. This CIE will help us build a system that works better out into the future. The target of health equity includes providing culturally and linguistically responsive services. It reduces multiple screenings, reduces time, creates efficiencies, especially connecting across silos, and centralizing information and actions, referrals, checking if they have been fulfilled, etc., and provides transparency of information. It also provides accountability so that in partnering, we know who's coming through and supporting people who need it most. We have some work to do around future investments and planning. There is data and policy work going on. And in terms of privacy and consent, we have to think about whether we need to make it interactive. Here is where we have heard some of the value. Our presenters will talk about the value for them, but we'd be interested in hearing what you think about the value. There's more around efficient search of opportunities, but with that, I would defer to the next speaker. Thank you for giving me the opportunity to share.
Thank you so much. I'm just going to quickly touch on the overall CIE landscape before we turn it over to our presenters who use CIE themselves. So CIEs are spreading across Oregon with most counties having some presence. And there are two main CIE vendors called Connect Oregon or Unite Us and Aunt Bertha. There are some other efforts going on as well. These efforts are mainly funded by coordinated care organizations or CCOs, health plans, and integrated health systems, and are free to join for community-based organizations, local public health authorities, and tribes. Connect Oregon and Aunt Bertha also have free training and assistance configuring their tools and adapting the workflows. These are the counties currently using or in the process of implementing Connect Oregon. Aunt Bertha has free tools available across Oregon, and they are working with Cascade Health Alliance and Trillium Community Health Plan in these counties. We also have this information available on on OHA's CIE flyers, which will be posted in the chat later as well. And now we wanted to take a few moments for some initial questions, if there are any, before we go to our presenters.
Don't see any coming in, and I don't know if anyone's trying to unmute and is not able to. So I don't see anything in the chat though.
I see Bill raising his hand.
Oh, I can't. I'm not looking at that part. Sorry.
I'm a very good rule follower. You know, I'm raising my hand. Just stay in line. Just bear with me. So again, so my name is Bill Bainey. I'm with ODHS, with Self-Sufficiency Program, overseeing the design and implementation. And I've been involved in some conversations with Lisa, Hope, and the rest of the OHA team that's been really leading some of the CIE efforts over the last year or so to get a better understanding of what's happening. And I think as a concept, CIE as a concept is really something it's really something interesting and something to explore. I think as Dawn was mentioning earlier, I think looking and supporting our collective families and the families that we share, these are our shared families, and how we're providing the support for our families in a more holistic, more integrated way, more intentional, meeting the needs in a timely, effective way that's going to be grounded in equity, that's really going to be provided at the local level. I think it's going to be responsibility and opportunity for all of us to really look into. As we're moving forward, we're really curious to see how this is going to unfold. I think OHA is really leading the efforts and how they're really moving the needle on what CIE might look like. I think for us at ODHS, we are really curious about what that might be. And I would offer we're in that exploratory stage, if you will, and staying an active partner in hearing how it's unfolding and what our role could possibly be. I just really want to just like strike upon, I think the recent pandemic and the pandemic that we're in right now is nothing but really illuminated some of the disparities that are facing our communities right now. In particular, the communities, the Black, Oregon tribal nations, communities of color, the impact that they've had by the pandemic, our inability to really serve them effectively, and I think our responsibility to look at things in a different way. So I'm really excited by opportunities that we can always look to that might address those gaps. And I'm hopeful that as we're having these conversations, as we're looking at what the opportunities are, we're exploring where this might fit, and we're exploring the plausibility of such a process. I'm not naive and I'm not Pollyanna, and I know there's going to be a lot of challenges. And I know there's going to be some struggles and some barriers. And I think interoperability, the functionality, I mean, is their systems working? I think those are questions to be kind of discussed and explored. And I would offer this is really an opportunity for all of us to have that conversation. And it is truly an exploration how to better meet our collective and shared family. So I just want to thank Lisa, the team, for kind of opening the doors and inviting me to be part of that conversation to learn more about it, and actually ODHS and some of the conversations. I'm not trying to oversell and say we're there, we're ready to jump in. We are really very much invested in hearing more about it and hearing how this might fit. So I just want to take a pause and just say thank you. And I look forward to hearing how this is going to play out.
Great. Thank you. I really appreciate Bill and Dawn speaking from their positions, and I like the terminology of shared families because that's really what we're dealing with. We're all trying to help the same people and coming together collectively. And so next we're going to have Susan Fisher Mackey, and I will hand it over.
Thank you, everyone. Are you able to hear me okay? Awesome. Thank you for that feedback. So I am Susan Fisher Mackey. I serve as the Director of Community Benefit Initiatives for All Care Health. And I'm so excited to be here with you today on behalf of the dozens of stakeholders in Southern Oregon who have invested their time and insight to help launch CIE here in Jackson and Josephine counties. Bill, I just want to echo what you said. There's a lot of hope in all of this work, and rightly so. I need to be cautious because it is going to be more complex than any of us can imagine in these moments. So I'm excited to really highlight why our community is hopeful. The returns on investment we believe that CIE's launch will make possible. In my comments, I'll share steps we've taken to move CIE work forward. I'll really highlight how long it has taken us and the due diligence that we did to find the right vendor, which for our community is Unite Us. And I promise not to shy away from some honest reflections on the challenges we've experienced during this exciting but complex journey. Before I launch in, I just want to center us for a moment on the picture on the screen. And it may seem strange that we're all gathered to talk about a technology platform, and that the image I most wanted to share and start with involves absolutely no technology at all. As I reflect on this image though, what comes up for me are the concepts of presence and trust, connection, and vulnerability. And our CIE journey in Southern Oregon has time and time again come back to these core values and experiences. And we believe that Connect Oregon, guided by local stakeholders and powered by the capabilities of the Unite Us team, represent our best hope for leveraging technology to earn the trust of clients and local practitioners, to ensure our ability to be responsive when clients share their vulnerabilities with us, and to maximize our workforce capacity, saving valuable time and energy as we mobilize to help those in need. So next slide, please. So as a coordinated care organization, All Care serves over 50,000 members in Jackson, Josephine, Curry, and Southern Douglas counties. We are so fortunate to be working on this Connect Oregon effort in alignment with our partners at Jackson Care Connect, a CCO that also serves Jackson County. Coordinated care organizations are networks of all types of healthcare providers, including physical, behavioral, and oral health care. And we work to ensure that all of these providers collaborate both with each other and with their local communities. Our efforts benefit members of the Oregon Health Plan, also known as Medicaid, as well as the broader community through our investments in the social determinants of health and equity. One way we think about this work is called the triple aim: And that drives us to stay focused on improving population health, enhancing patient experience, reducing costs, and improving work-life experience for providers. So before joining the team at All Care, I worked for a decade in direct service. I worked in many roles, such as a home visitor for Early Head Start, a teacher in the K-12 system, and I even owned my own early care and education center. And so for me, as I moved into systems work, this exploration and potential of community information exchange became very personal. I remember the countless clients who entrusted me with their stories of need and hope, but there was often little I could do to efficiently connect them to services available in our community. And right now, it's largely healthcare entities such as coordinated care organizations or hospital systems that are driving CIE work. But we're doing this because we believe in CIE's capacity to better connect all local partners, and as a result, provide better care to those in need. We recognize that social service and community-based organizations are truly the experts in this work, and that they are typically underfunded and often grant reliant. And we recognize that these organizations have historically lacked common infrastructure on which to partner and serve those common families, those common individuals. So All Care and Jackson Care Connect are really excited to embrace this opportunity to support the acceleration of community health improvements in our region through being a part of the Connect Oregon CIE. Next slide, please. So this has been, and we know will continue to be, a journey of complex change. It has asked us to come together around a common vision, to align on a strategic plan, and to secure adequate resources to move us forward. We've spent a lot of time thinking about the skills it will take, both from our community partners and from our technology vendor, to ensure success. We've also had to get really honest about what factors contribute to or take away from incentives for jumping into this new work. Our work on CIE actually began in 2014 when our community experienced the devastating loss of an entire family. As we began to come to terms with what had happened, many of us working in direct services, we connected with each other behind the scenes. And what we realized was that no less than a dozen agencies were working with the parents and children at the time of the tragedy. But none of us had more than the information in our own case management files to help us understand the risks that they were experiencing. It was then that several local organizations asked leaders at All Care, Jackson Care Connect, and Jackson County Health and Human Services to step in. And their request was for the partners to lead an exploration of technology platforms that would enable community information exchange, though at the time, we always referred to it as closed loop referral. In 2015, after looking at several product options, the three funders worked with a capable technology company to design our system, but to be honest, work on CIE was truly in its infancy. And much of the focus was on the technology and not on what it takes to authentically engage a broad group of community stakeholders or to ensure ongoing local oversight of the system. We were having to coordinate alignment, have difficult conversations, and develop staffing models, all while thinking about how to get our vendor to configure the widgets of the technology in a way that would work for a diverse set of programs' workflows. Ultimately, we did reach the needed agreements and even had the platform configured, but when we experienced a shift in local leadership, the effort paused out. But luckily for all of us, many communities across the country were able to persevere in their work with CIE, and it's their successes that have paved the way for our current work in Oregon. Initial contracts for CCOs were in place for 5 years, and as CCO 2.0 launched, there was a renewed focus on leveraging healthcare transformation to positively impact the social determinants of health and equity. And really, this inspired our community to come together to renew our work towards launching CIE in 2018. In 2019, we really hit our rhythm of alignment and acceleration, Both All Care and Jackson Care Connect convened board-appointed steering committees that included representation from our staff, as well as a cross-section of other regional leaders from key cross-sector partners. We were mindful also to include members on these steering committees, knowing that the wisdom of their experiences would be key to the system's success. Together, we dug into viewing available platforms, listening to experts from around the state who were already deeply engaged in the work of CIE, and reading available literature on best practices. We also established a connection with the team at the Oregon Health Leadership Council, and I know that Liz Whitworth is on the phone today, and we can't thank them enough for the wealth of quality information, networking opportunities, and technical assistance that they've provided us along our journey. In 2020, after many months of candid, inspiring, but often challenging conversations, both CCOs reached the same conclusion. The decision for us was clear that entering into a contract with Unite Us was the best way to set our community up for success. Unite Us surpassed any other product with their demonstrated track record for accomplishing implementation of both the technology of CIE and meaningful community engagement of diverse local stakeholders by empowering them to guide the system's development and long-term growth. After moving through contract negotiations, we moved into the process of socialization, and throughout it all, the Unite Us team has provided servant leadership, going above and beyond to customize learning sessions, develop onboarding pathways, and explore with us how the system's functionality can enhance the great work already taking place in our region. A major accomplishment we're so proud of right now is that we have launched the Community Network Advisory Board, which is seated with over 24 stakeholders representing a diverse array of services in our community, from workforce and early care and education to community justice and clinical providers. It is this board that will have the opportunity to guide the long-term oversight of our network and to make recommendations for improvements. And just recently on April 20th, Connect Oregon went live in Jackson and Josephine counties with an initial wave of 26 participating organizations and an additional 7 that are in the final stages of their registration process. This means that over 160 individual users are now leveraging the power of Connect Oregon and the Unite Us CIE to send and/or receive referrals to over 46 programs. Next slide, please. So we've learned a lot through our journey, and I'll try and move quickly. But the number one thing we've learned is that CIE implementation needs to be driven by local community wisdom. This work can only be done with broad engagement and commitment from representatives of a diverse set of stakeholders that are given meaningful roles in planning for and moving through implementation. In selecting Unite Us as our vendor, we ensured sustainability and scalability because of their experience in implementing CIE across the country. But we also ensured that local wisdom will guide their work because they hired a community engagement manager that lives right here, and her focus is truly on understanding what we need. This work also needs to align with other movements in a community such as public health modernization, collaborative community health improvement plans, and continuums of care. When we let communities drive these efforts, we need to lean in. We need to listen to the current pain points in our community, as well as what people are excited about. And we need to be willing to stay at the table to find solutions. So it's not always easy. It takes time. And so we encourage you to plan time and space for these conversations and the process of collaborative problem solving. In order to achieve alignment and accelerate your efforts, we really want to encourage you to engage funders that are willing to provide bold leadership and long-term investment resources. And we'd encourage you to have those funders be ones that understand that broad community engagement is key. Once the ink is dry on a contract with a CIE vendor, it's really in the community's best interest for those funders to step back and let the community guide this work in partnership with the vendor. We've been amazed at the traction CIE has gained in Southern Oregon. It's largely due to historical efforts by other partners, and it's been due to sharing our vision widely and early in this process. I would encourage you to be open to the feedback that will come in, because our communities have been working for a long time to address the needs of common clients. And they've already come up with innovative solutions, and they'll want these worked into whatever CIE solution you choose. It can take work to piece together how to both honor and maintain what is already going well and blend that in with the robust technology of CIE. There's some questions that I would really encourage you to ask your potential vendors, or if you are not a decision maker around which vendor comes to your region, to contribute as there's opportunity to provide feedback or join a steering committee. Ask, does the vendor have a caring and competent staff to support the work you'll need them to do? Unitas has provided us with an account manager, a network health team, access to their chief compliance officer. They've given us help from their communication team, and they've also lent us the insights of their vice president of social care integration. Ask them if their CIE has solid standards in place, and how does the system help with secure data exchange with consumer consent, especially for sensitive service populations. These standards are really the foundation that will build trust in your community, that all users of the system have been onboarded well and are receiving ongoing technical support needed to ensure CIE does the most for your community. Ask the vendor if they have a bold plan for future development that is also able to be responsive to your community's unique needs. Unitas is currently working with our regional early learning hubs, our community action agencies, and other providers to develop workflows that decrease administrative burden and increase outcomes for systems and families. We're also incredibly excited about their new payments module that will soon be released, and how it will increase our community's capacity to augment often limited community-based organization budgets to ensure adequate supply of quality services in response to increased referral numbers. Finally, I'd encourage you to ask, how does your CIE address health equity? Does it have the capacity to bring forward opportunities for change through robust and transparent data reporting? And is the platform available in multiple languages to help your culturally and linguistically responsive providers provide care to everyone in your community? Finally, as you plan for and implement your CIE's ongoing governance body, I encourage you to engage champions that have broad spheres of influence and represent a diverse array of sectors. Again, we're really excited about our over 24 Community Network Advisory Board members who have committed to be with us for at least an 18-month term. We want to encourage you to ensure representation from your culturally and linguistically responsive organizations. And because we know that any new technology or initiative can have unintended consequences, centering these voices is absolutely essential. Last, I would tell you to invite skeptics to the table, as they will provide you insights, honest feedback, and the opportunity for system improvements to ensure network health. Next slide, please. So even though this has been a long journey, we're really just beginning our work with CIE in Southern Oregon. And right now we're shifting our focus to network adequacy and to ensure that our network has enough of the right providers to address local demand. We're going to continue working with Unitas to invite new partners to join the network based on data trends. And the Unitas team will engage in their best practices to ensure that the network is used by its participants and that it empowers them to efficiently connect a high volume of people to services. We look forward to how all of this will help us ensure that providers have new sources of funding to address social needs and to drive community impact. We know that as Connect Oregon improves in Southern Oregon, we will see the ways that it contributes to individual and population health outcomes. Next slide, please. So I want to draw us back to this picture where we started together. And regardless of where your community is on its own CIE journey, or which vendor you choose to move forward with, I just encourage you to come back to the values and experiences we've reflected on at the top of my comments. We are all here to earn the trust of clients and our local partners. We are all here to ensure our collective ability to be responsive when clients share their vulnerabilities. And we are all here to maximize our workforce capacity, saving valuable time and energy as we mobilize to help those in need. So last slide, please. So here again are just a few of the partners who are around the table. We do have a state network advisory board in addition to the regional network advisory boards, where we're looking at addressing barriers to continued rollout and implementation and ensure that the Connect Oregon effort is truly additive to the work that's already being done in our state. I'd encourage you to go to the Connect Oregon website or to reach out to either the leadership at the Oregon Health Leadership Council or at Unite Us. They'll be able to provide you with a lot more information on data reports that are available and what the system actually looks and feels like. But on behalf of my teammates at Jackson Care Connect, our entire team at All Care Health, we would also welcome you to reach directly out to us. We'd love to have a conversation with you and really look forward to this continued journey in our state on behalf of our community members.
Great, thank you, Susan. And I think just for time reasons, we're going to move on to our next presenter, and then after that, we'll see if there are questions. So let's turn it over to Katya from Project Access Now. Thank you.
Okay, thank you, Lisa. Hello, my name is Katya Risiaga. I'm one of the program managers for the Outreach, Enrollment, and Access team at Project Access Now. And if I can have next slide, please. And I'm presenting or representing Project Access Now today as I think I have it in a different order. Can I go to the next one? I'm sorry. Yeah, so let me first explain you who we are. So for those that you guys don't know us, we are a nonprofit organization working to improve the health and the well-being in our communities. We are in Portland, and we basically serve Washington, Multnomah, and Clackamas counties. And what we help is people to connect with or access for especially medical or services when they need. And the program that I manage is with, there's two managers in this program. It's my other colleague, Ellie Solares. We manage a team of 8 application assisters that help individuals to get connected to the Oregon Health Plan or the Marketplace or any other medical services that they need or insurance are available. So next slide, please. And I'm gonna try to go a little bit. So we, the reason that we connect with Unitas and why we thought it was very important, we had been working with our communities since, 6 years for now, and always within our mission, it really aligns with United's mission to connect individuals and make sure that they're healthy and they receive what they need in the community. So historically, our assisters, when they help the community, they always help clients for other services to find services when they looking, like, for example, if someone come to us and to enroll for the OHP, but they share that they maybe need rent assistance, or they need food, or they are looking for a job, or there are many other services that they always share with us that they need. So when we were live before COVID, it was a little bit easier to share those resources to the clients. But for when COVID started, that everything came virtually, we are helping all the clients over the phone right now. So it came more imperative to really have this platform and that can help us to connect people and not just give them the information on where to go. It's very important for us that they are taken care, making sure that they're connected, making sure that they really receive the service that they need. So something that we found that was excellent, that the system tells us that if for some reason we make a referral and this for whatever reason, like it could be that the service is no longer available, or the client probably doesn't match with the criteria for this organization that we made the referral for, they let us know, so that way we can look for something else. So it's not that the client is just left in a limbo. So it's that we know the client is going to be taken care. So what for us, it was really important that we have that kind of platform where we can help our clients in making sure that they receive what they need. Next slide, please. Okay. When we were filling this presentation, we heard from Unitas. Myself, I was in a presentation. I think I was like on October, if I'm not it was in October of 2019. And the first time when I hear about the presentation, for me, it was, wow, this is excellent. I definitely will want to be in. It was a great opportunity for what I saw is it was a great opportunity for people to send clients to us and know that we have the capacity to help people with the insurance, but also because regular times our assisters are located like DHS offices or schools, churches, community based organizations, or like clinics. Sometimes, I mean, so it was good that for us, it was like, well, this is going to be a great opportunity to let people know that we are here, and also to tell people where to go. But for some reason, I mean, I expressed my interest in, and I think the information got lost there. And I mean, I think that the ball was dropped at some point. But then when COVID started, for us was like, we need to find something. And I was like, I remember that I was on this presentation, and I remember that we have here about Unitas, so we contact back, and it was awesome, because actually the setting up and having us ready to go, it was very easy, and nothing complicated. They train our staff, and it was since then I think we have been working well. And now I'm going to leave it to Claudia, that is one of our sisters, and I want you to hear from her, because actually she's the star using Unitas, and I want you to hear from her. I mean, some of the challenges, yes, because we have some challenges on the way, but I think we have more successes and great experiences.
Thank you. Thank you very much, Katia. Hello, everybody. My name is Claudia Acosta, and I am with the Outreach Enrollment and Access Program. I am a sister, and it has been for Project Access now, of course. And it has been really nice to hear from Susan all the years that effort has been putting together to get here and to offer through technology all these resources, which I think it's great. It is great. When I hear first time about Unite Us, it was amazing. It was like, so we are going to have access to offer resources. It was like unbelievable for me, because it was like you can call to heaven and ask for help about anything. Usually we help people to get access for medical services. We have different programs, and we help clients sometimes for many years because they pass from one program to the next one, depending on the immigration status, when they have job or they lost their job, when they have this income or less income. So just to have, I'm very thankful for this resource, this system, and thanks for the technology that unite everything. We share the same vision. Project Access Now and Unite Us have the same vision, which is just helping and connecting, giving access. And so that same technology is what is lack in most of the clients that we have. They don't have access to technology. Sometimes it's really hard. They don't have a internet, or they don't have a smartphone. So it is a struggle. Sometimes clients of us, they ask their kids or their grandkids for their help to open an account, register, and get the password, and then the link to confirm, etc., etc. It's really hard. So it was amazing after the pandemic started, with just one phone call. And when we understood the huge network of resources, it was amazing, because usually we start helping our clients with a consent form. So they tell us everything. I have 3 kids, and this kid is not of mine, honestly, but this person works, this person cannot work because have no status, etc., etc. And we contact them when they are more vulnerable, looking for health resources, right? They are sick sometimes. And the health is not just about your body and your mind. It has to be with everything. They need to be secure. They need to have trust, and they need a complete conditions to succeed, right? So families, we are talking here about families circumstances, and last year everything collapses. All the calls that we got were looking for medical, because they lost their job. They need now Oregon Health Plan to help. They need food, they need clothes, they need help to pay their bills, or training to find a new job, all kind of resources. And Unite Us was the key for us. So I've been very surprised and happy to have and use this tool, a great tool. Our challenges, okay, so that is my experience. At the beginning, it was a little bit overwhelmed for me to get so many messages from the referrals that I placed. But then I learned that I can go to my dashboard and set what is more convenient for me, even though at the end I learned also that they are very useful, because when you want to know what happened with the referrals that you placed, who helped, when, and how, so you know everything. What else? yeah, February especially was a hard month, I think, because the resources were low and the need was really high. It was hard, but once I learned that there is no end to place another referral, find another option, another organization, and connect them, it was very useful to have all those emails. So it also has been nice to have clients from different places. Once you help someone, they start calling you. Can you help my sister too? And we tried, but this time was from California. And then the chat box from the system helped me and say, yes, we have an option over there, and we found some help for them. Other client was looking for help for his parents who were in Washington, and it was too far. We couldn't, but they're always we have 211, and they are great. They can be with the client with just one dialing number, 211. Everybody can place a call, any language, and they will have an option for you. Right now, so need the testing and the vaccine, and it's amazing, their job. What else can I tell you? Well, for me, I always think that one person cannot help everybody. It's impossible, but everybody can help one person. It's always possible. Thank you.
Thank you so much, Claudia and Katia. Okay, I think we're going over. So if anyone has a question for Susan, Claudia, or Katia, if you could put that in the chat, that'd be great, and then we'll try to respond via chat. But we're going to move on and have Maria from Cascade Health Alliance present.
Hi, everybody. My name is Maria Ramirez. I am the Community Engagement and Public Relations Manager at Cascade Health Alliance. Our CCO serves roughly 23,000 Oregon Health Plan members in most of the Klamath County Southern Oregon zip codes. Today, I'm excited to share our story of implementing our locally branded community information exchange network through Aunt Bertha. I'll be discussing our implementation goals, selection process, branded, our personally branded site, and some of the successes and challenges that we've had over the last 2 years since we began this, this incredible journey. Next slide, please. Great. So there were 4 primary goals that we were looking at as we began our selection process, and really we wanted it, we set these goals out to truly be community integration. First and foremost, it needed to be a collaborative partnership. We didn't want this to be driven by the CCO. We didn't want this to be driven by Cascade Health Alliance staff. We wanted it to be collaborative across stakeholders and collaborative with our community-based organizations. So what we did is we began this process by putting together a sort of steering committee through our Healthy Klamath Coalition, and mapped out what our goals for a CIE would be. The second goal that we had was to truly maximize resources. In a community of our size, we are the only CCO that serves most of the Klamath County zip codes, with only one hospital system in our region who serves the greater Klamath Basin, including parts of Northern California. And a lot of our resources and FTEs that we can put towards this project wear multiple hats. So it's something that we couldn't devote to one single person. We needed to make sure that it was something that was truly engaging and available to really maximize FTE staff, not only for ourselves at Cascade, but also for our CBOs. The next goal that we set is we wanted it to be a community integration. Klamath County has recently been certified as a Blue Zones certified community. And so our thought was partnering with our local Blue Zones project to maximize what they've already been able to do in their community integration needs, and tap into the resources and the committees and the folks that they've been able to already become established. And then the fourth and final goal that we set for ourselves is it truly needed to be a sustainable network. We have our smaller CBOs are still using, and we're still using up until about September of 2020, paper resource directories, which we know these are great. They're something we can print off for a client or a member of our community in need and point them to the right resources. But really, it made it very difficult to maintain. There was one person at each CBO trying to keep up and make sure these programs existed, and make sure they were open, make sure their hours and their contact information was updated. And so our fourth goal was truly setting up a sustainable network for our CBOs to be easy and accessible. Next slide. And that's where we landed in our selection process which took us over about 1.5 years to do. So we selected Aunt Bertha, and that's because Aunt Bertha's statewide network enables us to connect with residents of Klamath County, as well as address the needs outside of our service region just from day one. And the map below shows areas of that Aunt Bertha really represents all programs within Oregon. The heat map identifies areas of high search activity. And so this was the direction that our Community Advisory Council, our steering committee, and our selection process really led us to partner with the Aunt Bertha program. Next slide. Aunt Bertha's been growing their network in Oregon for years now, and they've seen their connections across the state grow as they continually add programs and their search activity grows. So what this graph, I know it's really small for you guys to see, but what this graph illustrates is the growth of searches, the programs, and their impact on connections to community-based organizations across Oregon on the Aunt Bertha platform. So that top graph highlights the searches that are happening in Oregon. And then that bottom graph highlights the programs and connections that are being had currently in Oregon. And this began starting in 2012 all the way through Q1 of 2021. Next slide. So as I said, we first began to engage with our Healthy Klamath Coalition, and that's comprised of a dedicated community members and agencies across sectors that are all committed to improve the health of our community. Many initiatives have emerged from the partnership with Healthy Klamath. And so when we were looking at which direction and the best way to implement a CIE, Healthy Klamath was the direction that we went. And so we tangented it off of Healthy Klamath Coalition and created the Healthy Klamath Connect, which is powered by Aunt Bertha. This is designed to connect healthcare and social services. So the graph below demonstrates our timeline for implementation. We spent most of 2019, starting in September, training our community on what an electronic system was. Like I said, we were still using program resource directories. And we started that off with our Community Advisory Council at Cascade Health Alliance. We then presented Aunt Bertha come and present in November of 2019 to our Healthy Klamath Coalition, which is roughly about 140 organizations, all represented by primary stakeholders within Cascade Health Alliance, Sky Lakes Medical Center, which is the hospital system. Sky Lakes Medical Center owns about 85% of the market share within Klamath County. And then several different behavioral health agencies and several different social determinants of health community-based organizations. And ultimately, again, had the Aunt Bertha team come back in January of 2020 and finalize a presentation. So once we met in January, looked at the Aunt Bertha presentation from November, looked at it again with our steering committee and our Healthy Klamath partners in January of 2020. In March, we went to our Healthy Klamath partner sharing and really discussed what direction we wanted to go. Do we want to continue the search, or was Aunt Bertha the organization that truly fit our needs and told our story? So after that, we decided that that was truly the way that Klamath was heading. And so we started partnering with Aunt Bertha early in May, is around when the contract was signed, and began site development all the way through August of 2020. We officially launched the program on September 1st of 2021. Unfortunately, Klamath was impacted by the fire season that was occurring in Oregon, across Oregon in early September. And so as soon as the 242 fire happened, we thought this was a perfect opportunity to launch it. And that's ultimately the deciding factor of when we decided to go. In 2021 is when we piloted it within the Klamath tribal health systems to really create that connection between health and human services. One thing I would encourage visitors of today's webinar to do is really look at aligning your community assets, your challenges, and your shared goals with your community partners' community assets, challenges, and shared goals. And your timeline could be as quickly as ours. In a year and a half, we were up and live. Next slide. This slide here just demonstrates our branded site. We branded it in the Healthy Klamath Coalition brand colors. It's their blue, it's their orange, that's their logo, because it's truly a community asset. This top image is the landing page, of which if you type in healthyklamathconnect.org or .com, that Aunt Bertha's helped us set up and maximize for our community. Typing in any zip code within Klamath County, and it would pop down to the lower image of what's available within our region and for our members. Next slide. I think we're missing a slide. Oh, here we go. Yeah, okay. So our true objectives is of our CIE is to enhance communication and service delivery across systems. And to do this, that's why we engaged with our community advisory council, our Blue Zones team, our Healthy Klamath. We truly needed to mobilize that already created connection that exists between local governments, our public health, the Klamath tribes, a variety of healthcare providers, community-based organizations, and our community health improvement plan work groups. The next step that we took is to engage directly with members within our systems of care network. That includes our Department of Health and Human Services, DHS, youth mentorship programs, OHA assisters and collaborative, and other entities within our SOC. After that implementation, because it was an easy connection into our K through 12 education districts, we started working directly with school counselors and school administrators to provide the service and create their connection in their schools. They have they're a direct contact to our youth and families. And so from engaging within the systems of care network and moving into the K through 12, it was a very simple transition for us. The final engagement that we've done thus far is a collaborative effort with our quality metrics committees. And directly into their care coordinators. So these were the steps that we've taken thus far to train CBOs or community-based organizations to engage and implement their programs into our Klamath County branded site. and begin really that closed loop referral and CIE process. Next slide. Yeah, so some of the successes and challenges, I will say that as the only CCO in our region with only one hospital system in our service area who does represent 85% of the market share, integration was not a difficult thing for us to do. Once we had our hospital system on board, and within that included their case managers, that included their outpatient care, that included their physician groups. It was a smoother implementation for us, which allowed us to have that faster engagement. And on top of that, the community plan, that was a huge success for us. So we organized how we wanted to communicate this new resource. Our community is very used to paper and very used to the paper resource opportunities. We as a steering committee, as a Healthy Klamath Coalition, and as an organization, decided to create a community communication plan that each entity within Healthy Klamath, within the hospital systems, and within our physician groups, were all speaking about Healthy Klamath Connect to spread the word to seekers looking maybe not only for themselves or for their families to be able to access this new resource. From the start, at launch, this was in September of 2020, we had 25 local users, so that's organizations that were using the system, which are managing 62 different programs. What I spoke to earlier, what happened earlier in this year, first quarter, is we were able to implement this as a pilot project within the Klamath Tribal Health systems to truly foster that clinic and community linkage. So physician or providers and physicians within the tribal health system, if they were working with a patient who could benefit from their Second Winds program, they could easily log in during that visit, submit that referral to that smoking cessation class, and their partners within the clinic would then reach that and be able to engage instantly with those members. Some of the challenges, like I spoke to earlier, were just our community-based organizations' capacity. As a smaller community, our organizations wear a lot of hats. Our leaders wear a lot of hats, and they represent several different needs within our community. And so it is challenging to bring something new and give one additional hat to somebody else to help you drive. And so we're now trying to work with how can we make this an easy transition. And the Aunt Bertha team has helped us address this challenge. They've given us a direct account manager who's our go-to for all of our needs. They've given us a devoted project and implementation manager who helps us work with organizations to implement within their offices. They've also provided us with a direct contact to a community engagement manager who is on speed dial for some of our community-based organizations, and she will answer the phone via text. She will answer any emails. She will answer any phone, and truly she is on speed dial for a lot of our community-based organizations. And then ultimately they care about us and our story, and so we've been devoted with a customer service manager to help us throughout this entire process. Other challenges that we've come across is, since we did implement in September, mid-COVID, we've had limited opportunities to present at a group setting. We truly think we have 25 users as of September. If we had the opportunity to get all 140 organizations of the Healthy Klamath Coalition together in a true group setting, we believe our numbers would be higher, and this wouldn't be a challenge for us. Once restrictions are lifted, those are our plans to get the whole group together, share successes, share some challenges, and really grow the network locally. The final challenge that I have noted here is that our members, our CBOs, again, everyone wears a lot of hats, And so there's other initiatives that are going on. There's other things related to SDOH that are going on. And so implementing something new, something expansive of this, truly this expansive, it is difficult, but it's not impossible. Next slide, please. This slide, I just wanted to show what Aunt Bertha has been able to do. So there's two different ways within CIEs, and there's the open and focus, and then there's closed networks. Aunt Bertha is on that left side. You can focus on the network and priority partners and covered benefit programs while still providing access to a full range of national and state local programs and self-services. So what that means is every program that provides free or reduced systems, they want in their network or in their social their system. So not just folks that are contracted or need have agreements set in place, but it's a resource that's free and it's accessible and it's nationwide. Next slide. Yep, and I wanted to include this because this is what we also use with our customer service. We have a customer service management system called Salesforce that we have implemented Aunt Bertha in to make it simple and easy for our customer service representatives to be on the phone with a member and also directly connect that link through Aunt Bertha to any resources from Salesforce. They do not have to log into Aunt Bertha to do so. If that's a need, what they could do is in Salesforce, while they're looking up their chart notes or looking at the member's needs, putting in customer service notes, and they feel that this member that they're speaking to does need rental assistance or is food insecure, straight from Salesforce, it will communicate through Aunt Bertha to our food pantry or to our class action services without having to create several different logins. Last slide. And then there's I put this slide in just for reference for some folks after the webinar, because I did see that there were some questions on privacy and consent. So when you're looking at a CIE, there's primarily two different ways that you could do it. One is a per referral consent with like a permission-based access, and the other one is an all-in consent. And when you're considering privacy, these are two really important things that you should consider. We chose Aunt Bertha because of their privacy settings, because of the way that they've set up their data sharing agreements. And with that per referral consent and permission-based access, community-based organizations are able to access referrals based on the care coordination responsibility. So there's several roles set up that you can make for each user, but the private referrals should remain private, with the seeker having the choice to share. So the seeker is, if I am looking for an SUD service for myself and I put myself in, I could give consent to share my information, or I could just share, or I could just look at that. And that's what the difference between an all-in consent is and a per referral consent permission. I believe that's the last slide, and I wanted to give, yes, Martha and Brenda some time from our hospital system to discuss. So with that, Lisa, did you want to send it over to Martha and Brenda?
Thank you so much, Maria. And yeah, next we're going to have Martha and Brenda from Sky Lakes Medical Center. We might just have to, there we go.
Can you hear me?
Yes.
Okay, great. Thank you. Thank you, everyone. I've enjoyed listening to this presentation so far. Thank you, Maria, also for inviting me and to participate. So my name is Martha Decker-Hall, and I'm the supervisor here with the Sky Lakes Medical Center Outpatient Care Management Program. And joining me is Brenda Monroe Sierra, who is our intake specialist. Next slide, please. Okay, I'll talk briefly about how we set up our program. In a nutshell, it was quite easy. We benefited from some initial handholding from our local CCO, particularly Maria at Cascade Health Alliance. And what I appreciated so much about Maria, how committed she was to our success. She wanted us to feel supported and to be successful. And it felt so great knowing that she was only a phone call away. So we definitely took advantage of that. Next slide, please. Well, the first step we took was to claim our program once the initial setup was done. And claiming the program was very easy. We simply needed to provide our names and our contact information, email address, and so on. And once that program was claimed, we could tell that it was ours. You could see the little check mark, the green check mark at the top right corner of the screen. And so that just gave us the confidence to keep going forward. Next slide, please. After we claimed our program, it was time to do some initial setup with our team. We also relied on the ANTFERSA engagement manager, Erica Rodriguez. She was a cheerleader for us, very patient and caring, competent, and with really great follow through. Let's see, we looked at some of the, sorry, I'm gonna move my slide here. Once we had claimed our program, we had access to the free tools that we use today. So we were able to update and manage our program information. We went in right away and updated our service tags. We wanted to make sure that patients or clients were able to tell exactly what our primary services were and what our secondary services were. So our department, for example, we focus on patients who are at risk for frequent hospital admissions and emergency department visits. We focus on individuals with limited social support and provide chronic disease management and education. So we wanted to make sure that folks knew that that's who we were. But we also have strong, we offer strong support and help clients navigate other social resources. For example, we provide assistance with transportation, food, housing, and other services. So we wanted to make sure that our tags were listed correctly. We began to receive referrals. We updated this by email, and we began to look at our reporting tools to measure the kind of impact that we were having. Next slide, please. Okay, we'll move into how we began to receive and respond to referrals. Next slide, please. So at first, we connected with individuals through very simple one-step referrals. Those were quite easy, and we were able to update those via email. But then our expert intake specialist, because we also in tandem use the hospital's electronic medical record system, we determined that we needed to have more information about the person, for example, their date of birth, to properly identify them in the medical record. So it was so easy. We were able to set up a screening form to include a spot on there for the date of birth. Next slide, please. Once we began to receive the referrals, it was easy. We received an email notification on our Outlook. We were able to log into the Healthy Klamath Connect system. We were able to view the referrals, view the screening forms, and then reach out to the person, to the client, to attempt to engage them in our program. And then easily we're able to update the status of the referral. Next slide, please. So here we'll talk about some of the reporting tools that we have. So as we receive more referrals, we'll be building up our reporting. For now, we are able to view the different places that are searching or interacting with our program. At a high level, we're able to see the number of referrals that we receive and then break down the status. I do look at these. I'm able to check and I can tell you know, who exactly is sending referrals our way. One thing I really appreciate about our CCO, Cascade Health Alliance, is that, you know, they cheerlead with us. And so once a month when I have my meeting with the chief medical officer and other of our partners at Cascade Health Alliance, you know, I can report how many referrals we've been getting using the system. So I really appreciate the support that we get in return as well. And like I said, you know, it's just great to have cheerleaders who are supporting us. Next, please. As far as, we'll go ahead and go on to the next one. As far as supporting the additional patient needs, well, certainly, you know, we want to support our team internally as well, our case managers and our community health workers. Speaking of cheerleaders, I mentioned Erica Rodriguez already at Aunt Bertha. She was so wonderful. She was able to set up a one-on-one tutorial with myself and our intake specialist, Brenda. And then she hosted a WebEx for our entire team and taught them how to search for programs, how to help others connect with programs, how to share programs either via text or email, even on Facebook, which we haven't tried yet, and how they themselves could send direct referrals. I've tried this myself and I just love it. I was able to share with a person that I go to church with. I was able to share with her a program in her language. So that language feature is fantastic. Really appreciate that. Earlier today, I shared information about a transportation service that offers mileage reimbursement to individuals who may need gas reimbursement for a person that wouldn't ordinarily be eligible for like non-emergency medical transportation through the Oregon Health Plan. So those are some of the ways that we're able to support patient needs. As far as our successes, like I said, you know, we feel supported. This is great to have a closed loop referral system. It's safe, it's secure, it's so convenient. It eliminates referrals that could have fallen through the cracks ordinarily. And at a time when so many of us are working from home, we don't feel tied to a phone or a fax machine for referrals coming in from agencies that don't use, for example, EPIC, our electronic health record system. And then, you know, sounds small, but I haven't had to print brochures in a long time. Not having to invest in printed brochures or collect brochures from other organizations. It's nice just to have these in electronic form and save them to our favorites, create a folder and share them with one another. And as far as outreach to, finding our department, our outpatient care management department in a big hospital system website can be sometimes a little difficult. So it's nice to have that in my back pocket, so to speak. I carry my smartphone. I have Healthy Climate Connect flagged as one of my favorites. I have it bookmarked, and I can easily share my department's information with a community partner or with a person, a client or patient. So these are all some of the successes that I feel have made a difference for us. As far as challenges, I think my challenges really feel like opportunities. I've already added this Healthy Climate Connect to part of a new employee orientation process. So we'll be hiring individuals here in the months to come, and so they'll benefit from immediate training on this. A challenge can be that, we do experience employee turnover from time to time. So it's important that we make time to keep this in the forefront of our minds, to continue to offer training. I'm thinking even, some fun employee contests, just to keep it fresh. It's so important to keep it fresh, to keep it current, and to make time to explore available programs outside of our main zip codes. We have patients who often need services in out-of-town locations, and so we need to make time to explore some of those programs outside of Klamath County. And I think that as a community partner myself, it's in our best interest, in my best interest, to encourage others to use the system as well. So I think I need to practice my elevator speech so that I can spread the word. I think one of the things that how this has served individuals in our community is that I can see that it's going to create a sense of community. I'm reminded of a quote by Mother Teresa, that I remember she said that we belong to each other, and that's so true. And so I believe that this platform will help us with our work to become a bridge for one another.
Thank you so much, Martha. And so we just have 2 minutes left. I apologize, we won't get to a verbal Q&A. So if you can add any of the questions in the chat, we plan to do an FAQ that we will post on our website. But we are going to end with the last few minutes with Kara Kingus from 211 Info. And we'll have on our last slide the contact information for both CIEs. I just really appreciate everyone's time today. Thank you. Kara, are you available? She's trying to unmute.
Great, thank you, Lisa. Hi, everyone. I'm Kara Kangas. I'm the Director of Partnerships with 211 Info. And so here's just a couple questions about 211 Info and our partnership with different CIE platforms, and then how do we differ. So if you're not familiar with the 211 service, which I hope most of you are, it's a nationally recognized 3-digit number for anyone to contact in their local area to be connected to community resources. So we provide information and referral about resources, provide the resource to the caller, emailer, texter, and then they go off into the night. And so we often don't know what happens unless they call us back, and they may speak to a completely different person. So with the CIE, one of our programs under the 211 Info umbrella is the Coordination Center. So this is a contract funded by Kaiser Permanente. We're starting year 2 on May 1st. And what's nice is with a data sharing agreement with Unite Us, the 211 Info database is embedded into the Unite Us platform. So our care coordination team is able to go into the Unite Us platform, send in-network referrals, send out-of-network referrals, and follow up with clients as well to figure out what the outcomes look like, if the agency was able to accept the referral, And then if we did refer out of network, what were any of the barriers the client may have addressed, any additional needs they might have. And the service we're providing is very much client-led and client-centered. And so as often as they need assistance, or if they choose to cease existence at some point, we're focusing on them making the best decision for themselves. And so with that, does 211 Info has the same resources as CIEs. So right now, our only data sharing agreement is with Unite Us. We've had other conversations with other CIE companies, Aunt Bertha, Healthify, NowPow, Activate Care, which was formerly ActMD. And so what we're doing is working to find out what is best for each community. So what does the community want? What platform are they using? And then how can we embed into those systems if that's what is needed? And then the work that we're doing with the Connect Oregon, Unite Us. So as I mentioned, we are hosting the Connect Oregon and Southwest Washington Coordination Center. We went live right around the same time that the pandemic began. So launching a pilot project during a pandemic while we work remotely hosted some challenges, but we leaned into the work. We're a very nimble and flexible organization, and we have a great team that was able to take on clients and their needs as they came in. And then, and I mentioned too, working with other CIEs, we're always open to conversations with communities, with CIEs to figure out what works best for each community. Thank you.
Thank you everyone so much. Thank you, our presenters, our attentive audience today, for spending this time with us, and for and we're sorry we were not able to get to questions today, but in the chat and on this slide you will find where we'll post our FAQ later. And also if you have additional feedback or reflection or questions, you can email hope.heskin-shepherd@dhsohj.state.or.us.
Thank you.